Don Thomas's development of marrow transplantation was just an enormous accomplishment. It's a therapy that's now used to treat over 100,000 patients worldwide each year who are suffering from otherwise potentially fatal diseases. But as important as that is, I think the downstream potential of marrow transplantation leading to other novel curative therapies may be even more important. And I'll talk briefly about two such possibilities. Don showed that marrow transplantation could cure virtually every marrow-based disease, including those that are caused by genetic abnormalities such as sickle cell anemia, thalassemia, etc. Now, in showing that you could cure sickle cell anemia by destroying a patient's diseased bone marrow and replacing it with bone marrow from a normal individual, Don was also implying that if you could take out the patient's own bone marrow and correct the genetic abnormality, that also might offer a way to cure the disease. Recent advances in gene editing, including CRISPR technologies, actually show that this is possible and is being done. That is, we now are able to take patients with, for example, sickle cell anemia or thalassemia, remove their bone marrow, fix the defective gene, and then replace their own diseased bone marrow with this now repaired bone marrow, curing sickle cell anemia or thalassemia. It sounds almost like science fiction, but it is able to be done. Not only is it able to be done, but it's already been approved by the European Medical Association for use in Europe, and almost certainly for sickle cell anemia will get approval within the next year in the United States. Now, that's a terrific advance, but even there, it's going to be tough to take that kind of therapies where you have to take out a bone marrow, manipulate it in vitro, eradicate the patient's own bone marrow, and give the fixed one back. It's doable. It'll cure tens of thousands of patients, but it's unlikely to have the kind of worldwide benefit we'd like when we want to cure millions of patients with sickle cell anemia. And so now what investigators are doing is they're developing vectors that can be injected intravenously, that can go to the bone marrow, get into the nucleus, repair the abnormal gene, and cure the disease. I mean, can you imagine the fact that we might be able to cure sickle cell anemia, the millions of kids that have it, with a single injection? This would be part of the legacy of Don Thomas. And there are lots of reasons to believe that this can be done and will be done in the not too distant future. A second legacy of Don's work is the demonstration of the power of the human immune system to eradicate disease. Now, we know that the human immune system can get rid of a bacteria or a virus, but it's been hard to use the immune system to get rid of malignancy. But Don was really the first to show that this really is possible. When we did transplantations in the 1970s, we found patients who were transplanted from an identical twin had a higher rate of relapse than patients who received transplants from siblings, and the relapse rates went even lower if the patient developed some graft versus host disease. If you took the immune cells out of the donor bone marrow before you did the transplant to try and get rid of graft versus host disease, the relapse rates went right back up to those seen after identical twin transplantation. And the only way to explain that was that the new immune system coming from the donor was seeing the leukemia as being foreign and rejecting that. Once we had that observation, then the race was on to try and find the T cells that were responsible for eradicating the leukemia, to figure out ways to grow those into large numbers and use those therapeutically. And today we are able to do that. We're able to take out donor cells or patients' own T cells and genetically manipulate them so that they can see the leukemia or the lymphoma or the multiple myeloma as being foreign, inject those cells, and cure patients who had otherwise incurable malignancies. The therapies that are so-called CAR T cells, for chimeric antigen receptor T cells, or TCR T cells. There are now 6 of them that have been approved for use by the FDA in the United States, and This is just the beginning. We now have shown that it works for leukemia, lymphoma, multiple myeloma, and now certain solid tumors, including neuroblastoma and some other malignancies that I think will change the face of how we treat medicine, how we treat cancers in the future. Don's legacy is just enormous. He developed marrow transplantation, which is a therapy that's able to cure hundreds of thousands of patients worldwide. But not only that, it's led the way to the new avalanche of gene therapies and cellular therapies that are going to change the face of medicine in the future. I wanted to tell that story in my book, Living Medicine, and I hope that you can find it at wherever you buy books. It's been published by Mayo Clinic Press, and I hope you enjoy it.